I'm going to bring some of my PhD data, actually. That's some phenotype, genotype relations that we found alongside my group, University of São Paulo, especially Professora Umbertina Conti-Reed and Professora Edmar Zanotelli. And actually, we found, well, first of all, what is our justification for the work is because we need more data to correlate studies with Brazilian patients and perhaps leave a little bit aside from only United States and European experience. And we need to further characterize systemic and nervous system involvement of these patients. And obviously, there's the importance of natural history studies, and perhaps we can actually add some information about that. So the objective here was to characterize clinically, molecularly, and imaging studies in patients with LAMA2 related disorders. I have data about LAMA2 gene in Brazilian population. Right now, we're gathering a lot of centers, and I've already have 138 patients. That's a lot, but I'm not going to present this right now. So if anyone's interested about this data, I can show it to you. And actually, we have some interesting data too about natural history profile. But today we're going to focus on characterizing the findings of brain MRI and also correlating important clinical findings with phenotypic findings. So actually, this is a retrospective and prospective observational non-interventional longitudinal study that we've made in University of São Paulo from March 2018 to July 2022. And we've gathered patients with 2 pathogenic variants in LAMA2 gene and also patients with at least 1 variant plus typical clinical phenotype and typical muscle biopsy. And I want to say that this was actually said before today, that LAMA2 is expressed in a lot of other tissues. And I want to say that we have obviously muscle, but we also have neuronal glial cells and also endocrinal cells. And this is the most important tissues that I want to show here that perhaps have some important relationship with the phenotype. And so here, there's the first results that we have. So from 63 patients that we've been following up from all these years, we've gathered 52 brain MRIs. And we've seen that sometimes patients with lower muscle involvement had also lower involvement in white matter disease. And actually, the patients who were more severe about functional and motor phenotype were also more severe in images. And here we have, from these 52 patients, we had 10 patients who also presented with brain malformation. And we didn't only find only in occipital lobe, which is more usual, like polymicrogyria, but we also find lissencephalia and also found cobblestone malformation in other lobes like temporal lobes and frontal lobes. Here, I want to point out that this is very hard to see, and we had the help from 2 radiologists that are specialized in brain and in pediatric images, and because perhaps sometimes I think that we may miss out these images. We have to look further for them. And I want to actually add that I think in 2020, Jayakodi and colleagues showed them postmortem biopsy in patients that usually, at first, they thought they only had occipital polymicrogyria, and then in the brain biopsy, they found that they had a lot of other malformations that were not seen before in the brain MRI. And here we also found temporal cysts, and this is also pachygyria, lissencephaly in the occipital lobe, and also polymicrogyria in perosylvian temporal region, like in C, letter C. And we found that these patients actually had more epilepsy too. So 15% of our cohort had epilepsy, and the mean age was similar to what was previously shown by Natero de Benito and colleagues in 2020, around 8 years old. Actually, most of the seizures were focal and disperceptive, and actually most of the patients were easily controlled with monotherapy. And from these patients, actually, there were 10 patients, 9 we found brain malformation. And we also found patients with intellectual disability. 5 of them had brain malformation. And actually, one of the patients who had intellectual disability was able to walk and didn't have brain malformation, but actually had autism spectrum disorder. And what we found about the genetics, there was a lot of different mutations throughout the whole gene. 21 of them never reported. And we also found a lot of CNVs, and especially I would like to point out the deletion of the exon 56. That's actually a Portuguese mutation. Brazil is really related to Portugal, but it's actually one that could be easily missed by NGS. So we have to double check that if sometimes the patient only have one variant. We also found, for example, deletion of the exon 3 and 4. That's basically a Chinese mutation, but then again, we have some Chinese people, especially in São Paulo. I'm just watching my time here, so I won't pass, sorry. And so I wanted to present the more frequent variants. I wanted to point out, especially the first one, that's the frame shift one, the C1255 deletion, that was never described before. We actually found in this cohort in 11 patients, 14 alleles. So we had 3 homozygous patients with classic form presentation, but actually one patient whose homozygous was able to walk, and then she lost the ambulation and became wheelchaired when she was 10 years old, but she had a muscle biopsy with the complete absence of merisine. And those patients didn't present any brain malformation or epilepsy or intellectual disability. So that's not why we found as much brain malformation in our cohort. And we also found a lot other frequent variants that have been already described, some of them already been described here today. And I want to point out other 2. Actually, the first one have been said by Ana Rita, and it's a really common variant. And it's really interesting because all of the patients who presented at least one allele with this variant, they all walk, and they are really less severe than the other ones. They don't have brain malformation, epilepsy, or intellectual disability. And they could resemble like Emery-Dreyfus. And this other case, I think that something like Ana Rita described happened with us. So we had this really severe case that the patient never seated, and he had a muscle biopsy with complete absence of merisine, and we didn't find any mutation on that. And at some point, we thought that he had a homozygous mutation of the exon 21 deletion, but we were wrong. That was actually a misreading. So when we actually found that he had this intronic mutation, and he was homozygous, and then we found that 3 patients of ours who only had one mutation also had this mutation. And this is a really severe presentation. This patient has the most severe brain malformation, also has a really severe intellectual disability. And so this is some interesting data. Obviously, something to be true, a lot has to be seen before, but I think it's worth to show you that on those patients that we had brain malformation, we didn't present anyone that was able to walk. I know that's different from previous publishings, but we found that those patients usually had variants that would change the LG domain. That's so I won't be repetitive, but it's actually the domain that's connected to alpha dystroglycan. So perhaps that's something related to that. And we found so that these patients with brain, I'm sorry, that's important, with brain malformation had more variants in LG domain and also had more chance of having intellectual disability and epilepsy. And also those patients usually had new mutations in both alleles. And while we were seeing those 63 patients for these 5 years, I've noticed that a lot of the patients came to me to complain about hypoglycemia. And then I decided to check on that more thoroughly. And I actually questioned 48 patients with classic form of LAMA2 related dystrophy about it. And 15 patients had at least one episode of hypoglycemia. That's 31%, that's a lot. And 8 patients had more than one episode. And this is what actually what we've done was we checked when they went to the hospital and they had at least one symptom, we've checked the hypoglycemia. And if it was below 60, then we considered it. And that's really interesting because when we compare these two groups of hypoglycemia group with the 15 patients and without hypoglycemia, 33 patients, we found that none of the patients with hypoglycemia were ambulant. And we only found hypoglycemia in the non-ambulant patients. And the patients were between 2 and 14 years old. So actually that improved with age. 11 of them had hypoglycemia in the morning, so just to be, without eating during the night. 10 of them had related to infections, and the basic symptoms were somnolence, vomiting, and actually we also had convulsive crisis, symptomatic convulsive crisis in 2 of the patients. One of them actually that was so severe that we had to put a gastrostomy so we could improve the hypoglycemia and then stop having those convulsive crises. That patient did not present any brain malformation. And then we also found that these patients had more hypoglycemia, not only related to the effect of the motor function, but also how severely they presented. So the patients with hypoglycemia also had more chance to need a gastrostomy, and they also had more loss of function variants than compared to the patients that didn't present any hypoglycemia. And that's really interesting because actually hypoglycemia is not only related to a single factor like weight. We know that weight is related to it because extremely low weight, like below P3, is related to recurrence, but not the factor of the first episode. And this is really interesting because we found a paper that's studying that on mice, and it's related to LAMA2 down regulation is also related to the dysregulation expression of other genes, which are related to glycolysis, oxidative phosphorylation, and metabolic alteration. I think that Justin perhaps can say more about that if you want. And that's pretty much what I wanted to show you. Again, I can show you more data about natural history in Brazil and also about genetics. I'm really excited to collaborate with other groups, of course. And I want to say special thanks to the group University of São Paulo and special thanks to the committee to allowing me to be here today.